take a look at, yesterday we did we do flexors or extensors yesterday? Hold on, everybody. All right, so yesterday we did extensors, which were in the front. Remember when you do like leg extensions at the gym, or you extend out your toes, or you extend? We are doing flexors. Flexors of the ankle and toes. These are the muscles that help you grip the ground. These are the muscles that help you plantar flex, right? And this one to me is extremely interesting. This is your tibialis posterior. Now, I made a big deal about how important the tibialis anterior is. The posterior lies deep to the gastrocnemius. It lies deep to the plantaris, really even. It lies deep to the soleus. It is deep to all those things. What position would you put the foot in to hopefully loosen up the soleus and gastrocnemius so that you could press down through them and get to the tibialis posterior?
Can you repeat that question?
Yeah. I'm not asking what the client would do. I'm saying, what would you do as a massage therapist? What position would you put the foot in to make the gastrocnemius and the soleus loose so that you could press through them and get more easily to the tibialis posterior? Yes, Ms. Petrie.
So, are you talking about, I would put them in a prone position, have the knee flexed, and then have the foot in a plantar position.
Bam. That's exactly what you do. Sorry, I get very excited about this because this is where you are now applying kinesiology to your massage to make it better. So now that little bit of information that Ms. Petrie just laid out on us means that when she rubs the calf region, the sural region, the posterior leg region, most people often have those muscles taut, and they're getting the gastrocnemius really well. If you dorsiflex the foot and you keep the leg straight, you get the gastrocnemius really well. It's tight and you get it really well, but you don't get to the muscles below it. And so you're absolutely right. By flexing the knee, you release the gastrocnemius for sure. By plantar flexing the foot, you release the gastrocnemius and the soleus, and that helps make them softer to get through and push into the tibialis posterior. So I'm not saying you should always rub the leg that way, but you guys should realize there are layers and there are ways to get to the deeper layers. Because look at what the tibialis posterior does. It's really another calf muscle. Now, it's not called a calf muscle because it doesn't tie into the calcaneal tendon. It doesn't tie into the heel. But look what it does. It reaches underneath the foot. It grabs onto all 5 tarsal bones. Those are the bones that make up the arch of your foot right here. It grabs on underneath the bottom here, right in the center of your arch, and pulls that down into a plantar flexion. Pulls that down into a plantar flexion. Can also invert you just like the tibialis anterior can invert you, by the way. Both tibialises can invert you. Yeah. This is another reason to rub the arches of the feet very deeply, because this is where this guy inserts. So, there's no doubt that there are 3 calf muscles, but the tibialis posterior is a very helpful plantar flexor, which is what the calf muscles are too. And it doesn't grab onto toes. Its job is plantar flexing and inverting the foot when it needs to. So if you're going to categorize, if you're going to throw it in with somebody, it's not a digitorum, it's not a digitominimi, it's not a holosus, it's a plantar flexor, which is, it does the action of your calf muscles, and it's below your calf muscles. It doesn't hook into the same stuff, but that's what it does. Cool? Does everybody understand that plantar flexing the foot makes the soleus and gastrocnemius softer? I don't mean if the client does it. If the client does it, they're flexing. It makes them harder. It makes it looser. Okay, good. Okay, so that's the tibialis posterior. So really you've got this gastrocnemius here, soleus here. Don't worry about the plantars because it's up here by the knee. And then you've got this tibialis posterior underneath there. And you want to get down to all those. All of those. And they run the length of the tibia. They really do. Yeah. And you know that soreness you get like in the bottom arch of your foot? That really could be the tibialis posterior. Part of its job too is the arch wants to go up this way forever. The tibialis posterior pulls it back down. So when I say when you're walking, you're supposed to go squish, 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 squish down the hallway. Otherwise you break your feet. Well, this muscle is part of the thing that helps stop it from going back up too much. Kind of helps reset it every time. It's part of your arch support system. Yes, Ms. Torres, please.
I have a question. So, when you do squats, they tell you to wear a shoe that is flat instead of a shoe that has an arch.
I don't know that.
Oh, you don't know that?
No.
Okay, well that's the thing now. So I get the
Deadlifts I've seen flat shoes for, but I've never heard this for a squat. Why?
Yeah, it's literally when you do legs.
Why?
It's a leg thing now. Exactly, that's what I was gonna ask you.
Is it to strengthen your arches?
No, it's just for stability. That's what they say. But then it doesn't make sense to me because you have an arch.
Yeah. The reason a flat shoe does not make your foot flat, it just removes your arch support. And I would think that they would be doing that so that your arch support is required to be stressed. It's kind of like these belts that you see around everybody in the not just the gym now, stores and stuff like that when they're stocking and stuff like that. Those things are back support, but in some ways they make your back weaker, right? It never gets stressed. And so maybe they're asking for flat shoes so that you actually do stress your arches and build them. Mr. Kandaris, what do you think?
I like to think of it like this, like when you're doing squats and versus like when you do them with no shoes or with cushy arch supporty shoes. It's like, would you rather do squats on a hard floor or on a pillow? You're gonna have more support on a hard floor because it's like little pillows in your feet, and it's like jumping on a mattress. I actually feel like I can hit more weight being flat-footed than in like running shoes.
Okay. Well, that makes sense to me too. So you have more stability?
It just helps. Yeah, I guess. I've just observed this over years. Like even like our lifting coach in football, he wouldn't get mad if we wore Vans, like skating shoes, for lifting because he was like, yeah, they're flat-footed shoes. So
yeah. I do know that they don't like you to have heeled shoes in squats because have you ever seen people squat where they put a little bar up in front of them? Because it's actually not the best way to do your squat for lots of reasons. And so maybe the flat thing too is to make sure you really truly are in perfect anatomical position. Ms. Blodek, what do you think?
I'm just gonna make a guess,
Please.
but I was gonna say maybe it's because when you're squatting, you don't want to lean so much on your toes.
Yeah.
And you want to be on your heels more. So with the cushion, like what you guys are talking about, I don't know. I feel like you lean more.
You do.
And you don't want to do that because it's unsafe to do.
Yeah.
So.
You're in better anatomical. Yeah, you're in better position. I love your answer, Ms. Blodek. I hope you understand, Ms. Blodek. None of us knows the answer for sure. We're all kind of making.
we're all speculating.
Yeah, we're all speculating. Thank you, Mr. Kandaris. That's the big person word to use. We're all speculating. But your speculation, I think, is fantastic, Ms. Blodek. I think it's the reason I would give other people. And what I'm really glad about is this is kind of what we do with anatomy, right? You're making speculations. You just want to make educated guesses because we don't know everything. Doctors do the same thing, everybody. You don't go to them and they're telling you they're sure, but inside their head they're like, it's probably this. They don't know. They're trying to take their education and make a very good guess about your situation, then check it out. Anyway, I think you're spot on, Ms. Pilotic. Thank you. Thank you. Okay, so Ms. Torres, did you have more? No, okay. So anyway, don't forget about the tibialis posterior. What we're really trying to do is overemphasize the lower leg because so many therapists de-emphasize the lower leg. They really just rub shoulders and lower back all day long. And I think when you do that, you forget about some really important stuff like the hips and the legs and the feet. Actually, really the whole lower body. Most people just don't put the type of emphasis in it. They need it. And you will have clients come to you and they'll be like, I don't like having my legs done. And you'll work on them and be like, oh, I like that. Because nobody's really worked their legs right. They just haven't gotten in there and gotten the work done. Just remember there's lots of layers to the muscle in the posterior leg, the sural region. So we've got the 3 calf muscles and we've got the tibialis posterior back here. Let's look at some actual toe flexors. Look what we've got here. We've got a flexor digitorum longus. Flexor digitorum longus. These are super deep muscles. Super deep muscles. Flexor digitorum longus. And look what they're doing too, by the way. Both these muscles are running under the medial malleolus. They're running under the medial malleolus as a pulley to then pull down your toes from your calf region. Anyway, you've got a flexor hallucis longus and a flexor digitorum longus. But because you guys know that flexors are on the back of the leg, and because you know hallucis means big toe and digitorum means all the other toes, you know where these muscles go. And what do I really want you to do with that is remember those facts about digitorums and hallucises, but also just remember that there are flexors for the toes in the posterior leg. So now what we've really got is gastrocnemius, soleus and plantaris, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. We've now got about 4 layers of muscles, and that, I'm pausing for a second to make sure I haven't forgotten something, that takes care of the back of the leg, the posterior leg region. And again, they're coming from the back around the medial malleolus. It's a pulley to change the force and to pull these down. Yeah. Cool? You can actually see a great picture. Somebody can actually palpate them from the side because remember, most of the mass of your leg is coming from the posterior region. And that flexor retinaculum running across your malleolus down to your heel is literally there to keep the tendons around the pulley. You do not want the tendons popping off the pulley. And that flexor retinaculum, which is ribbon-like fascia, is there to keep it there. This is why, and I actually think I think that's right. I think Miss Petrie does this too. This is why you massage around the ankles sometimes. Because there's actually a lot of fascial tissue and it feels good. And there are tendons coming around there. They are high stress areas. Those bumps aren't there because, you know, God thought they were cute. Maybe he did. Maybe she did. But the fact is they're there because you've got to run them as pulleys. They have a real reason for being there. And all your flexors and stuff come around the medial pulley. Very cool. Very good stuff. Okay. So, let me stop. Oh, good, I did. Good. Okay. So let's do this. Miss Cooper. Miss Cooper, what are the 3 calf muscles?
The gastrocnemius, soleus, and plantaris.
Cool. Which one is most superficial?
Gastrocnemius.
Yes. Okay. Underneath the gastrocnemius is the soleus. The plantaris is kind of in that same area. It's so tiny. I'm not trying to, but let's forget about it for a second. Gastrocnemius, soleus is deeper. Then deeper to that, do you know what the next muscle is? Or any muscle deeper to that? Because there are 3.
Help.
Tibialis,
The tibialis anterior and
anterior.
wait, what? I'm confused. Posterior?
Yeah, thank you. Posterior, tibialis posterior, and then under that, we've got something that flexes the digits and something that flexes the big toe, and they're both long.
So it's the
Take your time.
flexor digitorum longus
Yes.
and then flexor hallucis longus.
Yes. Very well done. I'm very happy about that answer because it wasn't just from memory. It's really good. I like it. That's one of the best answers. So Miss Cooper just outlined the layers of the posterior leg, the layers of the sural region. She just outlined those layers as gastrocnemius, then soleus. I'm not forgetting about plantaris, but it's up kind of the knee. Gastrocnemius, soleus, then tibialis posterior, and then these very tiny but important flexor hallucis longus and flexor digitorum longus. So you guys know now the whole posterior leg compartment and how important it is, because all those muscles help in a plantar flexion if they need to, so all of them can get sore. And they attach underneath the foot and, you know, all that kind of stuff. Yeah. Cool? Awesome, awesome, awesome. Okay. And Miss Felix Osuna, what position do I want to put the foot into to make the top muscles? It'll actually make them all softer, but to make the top muscles softer, to get them out of the way so I can get to the deeper levels.
Could you invert the foot?
What now?
Did you have the client invert the foot?
I don't want to have them do anything. I want to do something to the foot.
Oh, so just
loosen-
have them like
To loosen up the gastrocnemius and the soleus.
yeah, to get them out of the way and get deeper.
Yeah.
So, like,
So what?
dorsiflex the foot.
If I dorsiflex the foot, I'm bringing the foot up, and that actually stretches those muscles out and makes them tighter. Does that make sense?
Also, yeah, the opposite of plantar flexion.
Yeah, I want to plantar flex for them. I want to push their foot down so they've got saggy muscle here. Guys, it's just like my flexors in my arm, by the way. If I pull my flexors down in my arm, they're taut here. These, I'm having to push against my arm, but these guys are taut right now. But if I bring it down, they're loose. If I give them the action they're supposed to do, but they don't do it, they're loose. And now I can push through them and get to places. If I stretch them, they actually get tight and they're hard to get through. Good. All right. Cool, cool, cool. So this also means, everybody, remember our knee problem that we were talking about? Yes, Miss Petrie, please.
I'm sorry, I'm just going back to the review that was just done by Ms. Cooper. I'm just wondering, just out of curiosity, is there a flexor mini-me digit that would be deep?
No.
Okay.
The reason I'm pausing is because I'm literally thinking. I don't think that there is a flexor digiti minimi longus, but there is a flexor digiti brevis, I believe, that is actually in the foot, which is why we haven't discussed it yet.
Well, is brevis, was that considered in front then? Is that interior?
No,
Brevis then?
no, not anterior, not. It would be in the foot, in the plantar region.
Okay.
So here, what I mean is, like, we've been talking about big flexors up here in the leg that come down under here, but you've got tiny little, we haven't studied the foot yet. We're going to find that there's a tiny little flexor digiti minimi brevis down here in the foot.
Oh, in the foot itself. Okay.
Yes.
So we're going over a review of the actual
Leg. We haven't gotten the foot yet. What happens is, by the way, just my hands are the same way, by the way. My most powerful muscles for my hand are up in my forearm. But I've got little assisters in here. So I've got thumb muscles up here that are actually in my forearm that are pretty big. But I've got tiny thumb muscles in here. Your thumb pad, which is called your thenar eminence, We will get to that. And this is your hypothenar eminence, but your thumb pad is called your thenar eminence. That's got small muscles in it too. And so we're talking about just like the foot, we're talking about there's a flexor digitorum longus, but we're also going to learn later when we get out into the foot, there's a flexor digitorum brevis in the plantar region of the foot.
Okay, but right now we're literally just talking about.
We're talking about the leg so that we could look at layers of the leg.
Yeah, got it. Okay, I was just curious. Thank you.
We could have, yeah, you're welcome. We could have divided up very differently depending on the book wanted to do it. We could have done our own thing and talked about all the flexors of the foot and stuff like that. It just seemed to make sense to kind of tie up the calf region for you guys. Yeah, good. I forgot what I was going to say now. Oh, so remember we were talking about the knee problem. Of all the muscles we've just talked about, the 6 muscles of the posterior leg, right? The 6 muscles of the posterior leg, Miss Giannis, of the 6 muscles of the posterior leg, which ones cross the knee joint?
The gastrocnemius and the plantaris.
Got it. So if I wanted to emphasize those, because I was working on a knee problem and not an ankle problem, if I wanted to emphasize those, not take away from, but emphasize them, what position might I put a foot in?
You would dorsiflex the foot?
Yes. Dorsiflex the foot and extend the knee. Yeah. Get the leg straight, dorsiflex the foot. That makes them tight so that all my pressure is going into the gastrocnemius on top, which I want it to maybe because I'm working on a knee problem and I'm trying to stretch it out. So on purpose, I'm putting it in a top position. I don't want to go to the deeper layers. I want to work the hell out of that muscle. And by the way, I will tell you the most powerful way to work a muscle is to put it in a stretch. That does not mean you should always do that. It is also the most painful way to work a muscle. Muscles in a stretch are much more sensitive, but what's happening is you're stretching all that stuff out and then you're poking it along the way or rubbing it or whatever you're doing. And that's making mini stretches along with your big stretch, and it makes the whole stretch work better. So that is the best way, in my opinion, to work tissue is in a stretch. But I don't do it through my whole massage because it's not pleasant and it's not always needed and it's aggressive. But if you came in with really severe stuff and I thought, oh, these calves are really powerful, but they're really holding us back, I might put them in a dorsiflexion and then strip them out to rip open your gastrocnemius. And you will get very effective stretching that way. Massaging muscles while in a stretch. Micro means small, macro means big. The stretches we do like in yoga and whatever, that's a macro stretch. It's a big stretch. And the massage really is nothing more than micro stretching. When you push down on tissue, you're stretching out that area. So why not stretch while they're in a stretch? Double up your stretch. Why not do some PNF stretching and then add some massage to that too? Now you got like 3 kinds of stretching going on. It's crazy. Cool? Cool. Questions, thoughts, anything? No. That's all the new stuff I had to cover today. I know that's weird. I did tell you this section would get easier, except for that one test that was very bad. Let's not think about it. The rest has been kind of true. Kind of. Let's take a 15-minute break and we'll come back and regroup and decide where to go from here. Okay? So we'll be back at 9:35. 9:35. Cool. Thank you all. I've been talking about the human body for a while now. So let's do some review on bones and muscles. Don't make the poopy face, Miss Giannis. Bones and muscles and all that kind of stuff. Okay? Very important. We have not done all the bones of the body yet. We have actually not done the skull. And so we will get up to there and talk about some of the not facial expression muscles, but important structural muscles in the face and neck and how they all tie together too. Because temporal mandibular joint syndrome is a real thing. Let's start out with the skull here. Yeah? Let me grab this. Miss Bilotic? There is a bone right underneath your head. There is a bone right underneath your head that your head rests on. Don't overthink this. What is that bone called?
The spine.
It is the spine. Basically, it's the spine. What's the first bone there of the spine called?
I think it's C1, correct?
It is C1, correct. Good. We're on a good start. This is C1. Can you give me another name for it? That is correct, by the way. That's the right.
Atlas or
It is your-
axis?
It's your atlas because it's holding the world up.
Oh yeah. So atlas.
Atlas holding the world up. So what's this next one, Miss Bilotic, called?
C2.
C2. Good. Good job. Let me ask you, do you know what, we haven't talked about this a lot. We have talked about it, but we have not done a section on it yet, so don't feel bad if you don't know it. But what action happens at C1 and what action happens at C2? They do very different things can kind of happen. Movements can happen at those joints. Do you know?
Ooh. I don't know. I think C1 would do like the flexion.
Yeah, C1 lets you flex and extend. She's right. It's your yes. It's your yes one, right? My head actually bobbles back and forth on C1. It actually sits on facets up there and does this. Yes. And what does do you know what C2 does?
I don't know.
You don't know what C2 does?
Oh, does it do rotation?
Yeah. So your head rests on C1, everybody, like this, and it bobbles. C2 actually has a tooth that comes up from the bottom of it, and C1 rotates around it. So the joint between C2 and C1 lets me do this. The joint between C1 and my skull, my occiput, lets me do this. Good. Thank you, ma'am. That was good. Miss Cooper. Miss Cooper, you there? Hi, Miss Cooper. Miss Cooper, what's the next vertebrae after C2 called?
C3,
Yeah, and then what's the next one?
C4,
Yeah, what's the next one?
C5,
Yeah, one more.
and then C6.
Give me one last one.
And then there's 7, so C7.
C7. What's another name for C7?
Atlas?
No, that's C1.
Wait,
It is the most...
oh, axis.
Nope, that's C2.
Oh, my bad. My B.
It's the most prominent vertebra. You can actually feel it poking out back here. Oh,
Hold on, let me think.
yeah. By the way, I do give you the answers in my questions usually.
Well, wait. Let me think about it, because I remember it. I remember learning it.
I know, it's a very prominent answer. Just take your time.
Isn't it just called vertebrae prominence?
Yes, vertebra prominence. So C7, because everybody, the reason I'm making such a big deal out of that, I don't care the name. The reason I'm making a big deal out of it is the bump you feel on people's backs. So it gives you an idea when you're around C7. Cool. Miss Cooper, what is the next vertebrae called?
Which one is it? T1?
Yes, thank you. That's what I was looking for. T1. And how many T's are there? How many thoracic vertebrae are there?
Oh no. Is it okay? Let me ask a hit. Is there more than 7?
There are as many as you have ribs.
So there's 12.
Yeah, very good. So it goes T1 to T12. Good. One last thing, Miss Cooper. What's after T12?
L1 through 4.
How about L1 through 5?
Oh no, I was so close.
You're so goofy. 2, 3, 4, 5. L5. Last question, I promise. What is after L5?
Is that a trick question?
No, I really want to know what's after L5. What is L5 resting on top of?
Your sacrum?
Thank you. Your sacrum.
I
Cool.
was like, there's not really another vertebrae, so it must be.
Yeah. Your sacrum, by the way, is called S1 because it is another vertebrae in a way. And it
Oh.
started out as multiple vertebrae and they fused together. That's why it looks kind of like multiple vertebrae. Yeah.
Well, that's big.
So by the way, everybody, so you all know this, you will hear people say, I have a herniated disc at L5-S1. They are talking about the disc between their last vertebrae and their sacrum. It's the most common disc to rupture. Second most common is L4 to L5. Why are these lower discs the most common discs to rupture? Yes, Miss Hunter.
Is it because they don't have as much support
Ooh.
as the upper disc?
Actually, I think that was not the answer I was looking for, but I think that is actually a very valid answer. They don't have as much support as the other discs. Yes, that was really good. And by the way, I think your answer is better than mine. I really mean that. They don't have as much support.
That's fine.
That's the thing. But the other thing along with not having that support is they've got more stacked on top of them. C1 just has your head.
Yes.
L5's got all the lumbar, all the thoracic, all the whatever, and so they're more like, but they're right. You're right, Miss Hunter, they're unsupported. Thank you. Okay, so when somebody says L5-S1, they mean the joint between, they mean the cartilaginous joint between those two vertebrae. Or if they say L4, L5, they mean this joint between the two. Cool? Cool, cool, cool. All right. What do we want to talk about there? Okay. Miss Yanez, out of all of these T1 through T12 vertebrae, I've got bones going out laterally both sides. What are those bones called?
Your ribs?
My ribs. Thank you, ma'am. I've got ribs coming out. These are horrible ribs, but there they are. I've got ribs coming out. Miss Yanez, what are the first 7 ribs called?
True ribs.
True ribs. Why are they true?
It's because they're attached to something.
Well, good. That's good. They should be attached to something. I like where you're going with that.
Is it because they're attached directly to the sternum?
Yeah, that's it. They have their own sternal attachment. So this rib, it's got cartilage attaching here, but it goes straight into the sternum. When you get down past 7, what happens is these guys actually attach to the cartilage. These lower ones actually attach to the cartilage of 7 to get to the sternum. And so what do we call 8, 9, and 10 then?
Those are false ribs.
Those are false ribs, right? Because they're cheating and they're attaching to the cartilage of 7 to get to the sternum. Cool. And what do we call 11 and 12?
Floating ribs.
Thank you. And they don't attach to the sternum at all. Very good. Hey, since you're on the call, what do I call these things sticking out the back of the vertebrae?
The spinous process.
Cool. And what do I call the thing sticking out the side of the vertebrae?
The transverse process.
Yeah. Does everybody know? I think we forget sometimes. These are to steer your back around. Like, these to allow muscles to pull me to do extensions. That's what these big things are for, is to pull me to do extensions, to help me get back. These ones on the side are there to help me flex and move around. They're big handles for muscles. Remember the multifidi, and rotatories, and all that good stuff? Okay. Cool, cool, cool. Thank you, Miss Yanez. Thank you. Okay. Let's see, who's next? Miss Felix Osuna. Miss Felix Osuna, the hips are made out of 3 bones on each side, actually. 3 bones on each side. What are the 3 bones that make up the hip?
The ilium, ischium, and the pubis.
Yeah, ilium, ischium, and pubis. Which one is most superior?
Is that the ischium? No, that's the ilium, right?
Ilium. The ilium, because the ilium is, it's kind of what we think of as your hip, right? It's that crest. That's the ilium. Yeah. And which one is most anterior and inferior? So it's anterior and inferior.
Is that the pubic?
Pubis, yes, thank you. And which one is posterior and inferior?
The ischium.
Ischium. Cool, thank you very much. Thank you. Miss Hanson. Miss Hanson, we were just talking about the hips, right? We've got these, let me see if I can get this over here so we can see it. I don't know if you can see this very well, but we've got the hips here. We've got the ilium, we've got the ischium, and we've got the pubis here. There's these bumps on the front, 2 on the front of the ilium, and 2 on the back of the ilium. What are those bumps called? There's 4 different names. But like,
You have the
give me the front one here, the front top one first.
anterior, superior, ilium notch.
Actually, anterior superior iliac spine.
Iliac spine.
But I could care less about the mistake you made there because anterior superior and knowing it was ilium was the right way to go.
Okay.
Anterior superior iliac spine as is. What's the one underneath it called?
Inferior, anterior, inferior, iliac spine.
Thank you. What's the one in back on top called?
Posterior, superior, iliac spine.
Yeah. And what's the one in back underneath that called?
Posterior, inferior, iliac spine.
Cool. What? This is trickier. Sorry, ma'am. What muscle attaches to the anterior superior iliac spine?
Is it the
It is the most superficial thigh muscle.
what?
It is the most superficial thigh muscle.
Oh, the gastronomy. Wait, what is the what's the back of the gastronomy? It's the oh gosh, what's that bone called?
Bone? Called what?
Yeah, isn't it attached to the doesn't it have the word the bone in it? The name?
No, you're thinking of the muscle that attaches to the anterior inferior iliac spine, and that is the that's the rectus femoris. That is a very superficial muscle. This one actually runs over it and across it.
Is it the it's not the IT band, is it?
Across it.
The gemella is I don't know.
The sartorius.
Oh, the sartorius.
Yeah, sartorius actually hooks all the way up here to the as is. The rectus femoris hooks to the anterior inferior iliac spine. Yeah, yeah. So anyway, it's just a good reason to run all the way up the legs. That was great. Thank you for struggling with me. I appreciate it. I really do. Cool. Let's see here. Mr. Kandaris. Mr. Kandaris, sir, what is this bump in the front of the hip called, the one that's above the other bump?
The anterior inferior iliac spine.
But that's the one below. I want the one above.
So the anterior superior iliac spine.
Yeah, the as is. Thank you, sir. Sir, what muscle attaches to that bump?
The sartorius.
Yes, and what muscle attaches to the bump underneath?
The TFL. No. Take that back.
It's a quad muscle.
Oh, the rectus femoris.
Thank you, sir. One last question, sir. What? Well, two in a way because they go together. What's this bump in back? On top called on the crest of the ilium here.
Wait, point to that again.
This
What
one right here.
bump?
It's on the iliac crest, but it's in back and it's on top.
You got me stumped on that one.
No, you can figure it out. You did the front one. Just reverse it.
Oh, right. Okay. Posterior iliac spine.
Yes, thank you. Last question, sir. Why do I care about that bump? It helps me find a joint. What joint does it help me find? This bump helps me find a joint. What joint is right here? Miss Cooper, mute yourself. Go ahead, sir.
Sorry.
What joint is that?
Yeah, what joint is right? It's not part of the joint, but it's right by the joint. And I use the posterior superior iliac spine to find a very important joint. That's between the hips and the sacrum.
Is it the ischiosacral joint?
Yes, or the yes, a sacroiliac joint.
Okay.
But I'm laughing because you're essentially correct. Sacroiliac joint, otherwise known as the SI joint. Cool. Thank you, sir. Miss Harper.
Yes, sir.
Miss Harper, what is significant about the sacroiliac joint? Why does Tapscott make such a big deal out of it? Like what? Who cares? Sacroiliac joint.
Because it's connect to the sacrum in the iliac crest, in the iliac spine or something.
Well,
It helps it helps to support the upper body and the lower body.
yeah, I like where you're going now. Now I really like where you're going. Are there any other joints that connect the upper body to the lower body that you can think of?
To the upper body, to the lower body.
Yeah, are there any other joints that connect the upper body to the lower body?
No, it's just the sacroiliac joint.
So it is the joint that connects the upper body to the lower body. So all forces from your arms, from your head, get back to this axial skeletal system and burst out through these two joints into your appendicular skeletal system of your legs. They're very, very key to it. Thank you, ma'am. You were on the right. That's good. I'm very happy.
Yes, sir.
But I know you're disappointed that I didn't ask you more, and so I'm going to ask
That's
you more.
fine, sir. Thank
No,
you.
Miss Madam Harper, as I like to refer to you. I have far too much respect not to ask you at least 13 really good questions.
No.
Okay, so let's see. Do you know what this bone is called? It's a hip bone. It's one of the 3 hip bones. It's the one in back and inferior. Do you know what this bone is that you sit on back here? Some people call it the sits bone. But do you know what this bone is? Which of the hip bones that is?
Is that the pubic or the ischium?
Well,
The pubic, yeah, that's the ischium at the back.
okay, yeah. And by the way, guys, I'm not trying to be weird, but your pubic bone is where you have pubic hair. Like, just so you remember. That's all. So, the ischium is where your tuschium is. All right? So, this is called the ischiotuberosity too. It's all bumpy here and stuff. Hey, what muscle group loves the ischiotuberosity? Loves it. Grabs onto it right and left.
It's the hamstring.
Yes. These are giant hooks for the hamstrings to grab onto and literally pull me back up. That was hamstring there. That's hamstring. Boom. Hamstrings. Yeah. Cool. Let's just continue. By the way, is there an adductor muscle that really likes to grab onto the ischium too because it's so far back?
Oh, adductor. The adductor magnus.
Yes. The adductor magnus is so posterior in the middle thigh that it is almost like a hamstring and actually has some extending qualities to it, and all the other hamstrings all the other adductors stack up on top of it. Really, really good. Ms. Harper, I think that's enough. Thank you. Well done. Thank you, thank you, thank you. You're so cute. Ms. Petrie was right. Okay. Who's next on my list? Hunter! Miss Hunter! Hi, Miss Hunter.
Hello.
Hello, Miss Hunter. Hold on. What? Ow! What bone is this? This thigh bone.
Femur?
Yeah. What is this cute little adorable kneecap bone called?
Patella?
Yeah. What is this thick medial leg bone called?
Crapola. I should know this for sure.
Crapola? That's not a bone.
What was it's not I'm sorry, I get all these things mixed up.
Remember I had a friend that
Starts
was
with an F.
it was kind of thick
Oh no,
in
it
the
starts
middle.
with a T. Oh. Is it okay, this is the thing I had a problem with on the test, I think. Is it fibularis?
No.
No.
The fibula is on the lateral side. It's the small bone.
Oh, that's a small bone. Okay.
Fibularis
So
is
then
a muscle, but you mean fibula, and fibula is a small bone.
Oh, that's what I mean, and fibularis and fibula get mixed up in my head.
But
anyway, the other one is the
tibia.
Oh, yeah, tibia.
I had a friend Tibby who was kind of thick in the middle.
Right.
I don't like that way of remembering it, but it works. It's a medial bone in your leg, and it's thicker than the fibula. Cool.
Awesome.
Awesome, awesome, awesome. It gets a little harder. Sorry.
That's fine.
I'm so sorry. Underneath the tibia is a bone that the tibia directly rests on. It's your first ankle bone, really. And it starts with a T also.
Oh, no.
No, it sits on top of the calcaneus. So the tibia is on top of this bone's on top of the calcaneus. The calcaneus, your heel bone, good. This one starts with a T2. I have not talked about it a lot. It starts with a T2, though. Any guess?
You said the muscle or bone?
Bone.
Bone. No, I cannot guess.
That's okay. Talus. Talus.
Oh, talus.
Is that what you were about to say, Miss Moore?
Yes.
Miss Moore, then this is a perfect jumping off place. Thank you, Miss Hunter. Good job. Miss Moore, you were going to nail the talus. That's amazing. Yeah. Cool. All right. Miss Moore, let's go back up on this skeleton. What are these collarbones called?
Clavicles. Hold on one second.
Yeah. Clavicle.
Pin you right here so you can be. Okay.
You're what? Oh, you're trying to be able to see me?
Yeah.
This skeleton is dying slowly. Okay. Clavicle. Good. And they're hooked to the sternum. What do we call this joint between the sternum and the clavicle?
The sternomastoid. No, the sternum. Wait.
You're on the right track, by the way, if it helps.
The sternoclavicular. No.
Yeah, sternoclavicular joint.
Was that right?
Yeah. Sternoclavicular joint, if that's what you said, you're right. Goes over the clavicle. Hey, what does the clavicle connect to laterally out here? What bony?
Acromion.
Acromion process. And what do you call this joint between the acromion process and the clavicle?
The height. No. Between the joint of the clavicle.
Just to remind everybody, I try to kind of give you the answer in the question. What's the joint? So listen. What's the joint between the acromion process and the clavicle? What's the intersection of Bell and 29th Avenue called?
Acromioclavicle.
Yeah, acromioclavicular.
Yeah.
Good. Okay. Acromioclavicular joint. I love it. Hey, the acromion process actually just goes ahead and turns into a feature on the scapula. What's that feature that it turns into as it heads around here?
The supraspinatus fossa.
Yes, the spine of the scapula, and then on top of that is the supraspinatus fossa. Very cool. Last questions. Since we're talking about the supraspinatus fossa, which rotator cuff muscle lives in the supraspinatus fossa? In the supraspinatus fossa, which rotator cuff muscle lives there? It sounds like
supraspinatus.
Yeah. Hey, what are the other 3 rotator cuff muscles?
Supraspinatus, infraspinatus, teres minor, and teres major.
No, teres minor.
Teres minor and subscapularis.
Good job. Thank you, ma'am. Hey, Miss Walker.
Yes.
Miss Walker, let's talk. Let's help this class actually review about latissimus dorsi and trapezius and deltoids and teres major. All right, let me ask you some questions, Miss Walker. If I say latissimus dorsi, you say what?
Teres major.
Why?
Because they're synergists.
Thank you.
Teres major is a synergist to latissimus dorsi.
They're synergists. They do the same thing, right?
Yes.
They both do extensions, adductions, and medial rotations of the glenohumeral joint. Excellent. Wow, this one's tough, but let's do it together, just for the heck of it. We're going to talk about the trapezius here. So, trapezius origins and insertions. What are the origins of the trapezius? Let's start at the top of the head.
It's the external occipital protuberance.
External occipital protuberance. That is the bump on the back of your head. Very cool. And then what is it attached to?
The superior line of the nuche. I can't remember the word before it.
Yeah, superior nuchal line.
Nuchal line. And then there's a ligament that goes from the
Occiput, down to C7.
Down to C7.
And
a ligament that it attaches to. And then it
hold
attaches...
on. You don't remember the name of the ligament, though?
Ligamentum.
That's okay. Let me ask one of my students here because
Ligamentum nuchae.
Oh, ligamentum nuchae. They got off the hook. Good. Attached to ligamentum nuchae. And then what is it attached to?
So then it attaches from T1 to T12.
Yep, spinous processes of T1 through T12. These things stick out the back. And that is all the origins of the trapezius before it comes out here and hooks on the shoulders. Miss Walker, I'm going to be right back to you. I want to see if everybody else was listening. Cool? So I'll be right back to you. Miss Stanley, what are the origins of the trapezius? I'm so sorry, what?
The occipitals.
The external occipital protuberance? The bump in the back of your head? Okay.
No, I don't know the...
Okay. Do me a favor. This is for everybody. This isn't just for you, Miss Stanley, because I know that people, when somebody else gets called on, they kind of tune out. Take notes, guys, because we're starting to actually review, believe it or not, for your test at the end of the year. These are the type of things that might be on there. You're fine, by the way, Miss Stanley. That was not me scolding you. You're absolutely fine. I'm going to come back to you, madam. Miss Walker, would you be so kind as to walk us through the origins of the trapezius again?
Okay, so it's the external occipital protuberance.
External occipital protuberance was just the bump on the back of your head that everybody can feel. Yep.
The superior line of the, so the neutral line, the superior neutral line.
The superior nuchal line, and it's the medial portion of it, and it's just a line that kind of comes out from the occipital protuberance along this back side of your head. Cool, thank you.
And then the ligamentum nuchae.
Ligamentum nuchae, which attaches your occipital protuberance 2, your spinous process of C7. Yep.
And then the spinous processes of C7 through T12.
Yes. Or T1 through T12. It doesn't matter. We got it. We got the point. Very good. Thank you. I'm going to come back to you again because we haven't even gotten to insertion yet.
Does it not, it doesn't attach to C7 spinous process? It
Well,
just attaches to the ligamentum nuchae of that?
I mean, I know this is not a great answer, but I really honestly mean it tomato. Like, they're talking about fascial attachments, and this is what I mean. Muscles attach, what attaches muscle to bone?
Tendon.
Tendon. And ligament is tendon. Ligament is tendon that attaches bone to bone. And so we're nitpicking like types of fascia back there. They probably honestly can't tell. They probably could have said it many different ways. They could have also just said this thing attaches itself via all sorts of fascia to C, the spinous process C2 all the way to T12. I think that would have been an easier way to say it. So I don't know what's happening right at C7, but you wouldn't be able to visually see the difference between a ligament and a tendon because they're the same tissue. So does the ligamentum nuchae come down there first and then get the tendon on top of it, or does the tendon sneak there? Who knows? It doesn't matter. They're intimately woven together.
Okay.
Cool. Yeah. And I'm sorry, I just don't have a better answer to that. And I don't think actually somebody with, like a surgeon would even have a better answer than that. They're just all woven in there together. It's just different ways of saying the same thing. Cool. Miss Monreal, what are the origins of the trapezius?
The occipital protuberance. Is that the whole word for it?
Yeah, that was perfect. I'm sorry. Occipital protuberance was perfect. The bump on the back of your head.
Okay. The superior nuchal line.
Superior nuchal line, the medial portion of it coming out from your head up here. Cool. Thank you.
Ligamentum nuchae.
Ligamentum nuchae, which attaches your head down to your neck here. Yeah.
Yeah, sorry, I was driving. I don't know what the problem was. Somebody was honking. Sorry. So I didn't hear what you said.
I just said yes, you're right.
Okay. And then T1 to T12.
Yeah, what parts on T1? The transverse processes?
Spinous?
Spinous processes, the thing sticking out the back. Cool. The T12, thank you. Hey everybody, I hope you guys see this. The trapezius is one of the 5 muscles that attaches the scapula to the body. So look at the trapezius, its origin is really just down from your head down to T12. Its origin is just here. We're just describing this area in very difficult terms. But we're just describing this area before we describe it inserting into the scapula. Cool, cool, cool? Maybe? Maybe not? Okay. Miss Petrie? Okay. You just had a very blank look. All right, cool. Miss Walker, where does it insert?
The trapezius inserts in the lateral third of the clavicle, the acromion process, and the spine of the scapula.
And remember, guys, that might sound confusing, but all she did was she started here and she traced her finger around here. You can do this on your own body. This is the lateral 1/3 of my clavicle. This is my acromion process, and that's the spine of my scapula. The muscle doesn't jump around. It just follows that line there. Lateral 1/3 of the clavicle, acromion process, spine, and scapula. Thank you, Ms. Walker. We're probably going to come back to you because we're not quite done with the concept we're working on. Cool, cool, cool. Miss Nguyen, where does the trapezius insert?
Insertion in the trapeze in the latter 1/3 of clavicle, acromion, and span of the scapular.
Thanks for knocking it out of the park. Thank you. Lateral 1/3 of the clavicle, acromion process, spine of the scapula. Hard words to say. Well done and correct. Thank you very much. Cool, cool, cool. All right. Miss Stanley, can you tell me, this is a lot, by the way, Miss Stanley, I'm not trying to pick on you. Can you tell me the origins and insertions now of the trapezius?
The origin is the occipital protuberance,
Yes.
the superior neutral line,
Yes.
and the ligamentum nuchae,
Yes.
C7 to T12.
What on?
Spinous process.
Yes. 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 Thank you. And then it goes over and inserts into where?
The lateral third of the clavicle, under
Yep. Lateral third of the clavicle.
the acromion process,
Yep.
and the spine of the scapula.
Could not have said it better myself. Thank you. Thank you. That's probably one of the hardest muscles to talk about, right? Look at all the words, all the stuff we talked about, all the things happening. Very, very good. Cool, cool, cool. Miss Torres. Miss Torres, what are the actions of the trapezius?
Okay, so it works bilaterally, so it helps extend the neck, the head and the neck.
Yep, beautiful.
And then the middle fibers helps adduct the scapula.
Really?
And then
That's really cool. So what do they grab on the side of my shoulders and pull them away? Like how do they abduct?
adduct.
Oh, adduct, adduct, pull them together, retract. Okay, cool.
Yeah, retract. And then when they work unilaterally, it helps laterally flex the neck or the head of the neck.
Yeah, I got you. Unilateral flex. Yep, cool.
Okay, to the same side, and then it rotates the head to the opposite side.
Wow.
Yeah.
That was a good one. Yes, she's right, by the way. If this side pulls, it pulls my head the other way. She's right, opposite side rotation.
That one was really confusing. Remember when we first started how confusing it was?
I was just doing it with the class last night, and I realized that if I really tape this up here really good, it works. So I know your trap doesn't go all the way over here, but I can't have my tape fall off. But watch this head. I'm going to contract this muscle, and the head turns to the opposite side. Contract this muscle, and the head turns to the opposite side. That's what the trap does. The upper fiber working unilaterally, yes. But it is confusing, very confusing. Cool, cool, cool. All right. And by the way, bilaterally, the upper fibers can also do something else that has nothing to do with the head and neck, but...
Upwardly rotate the scapula? No.
Actually, they can. By the way, the upper and lower fibers upwardly rotate the scapula, which is really tricky to visualize. We'll get to in a second. But elevation of the shoulders.
Elevate
That was the easy one.
Scapula.
You did all the hard ones. Very good. Thank you.
Is that it?
That's basically it. I want to draw a picture for everybody to see how the traps create an upward rotation of the scapula. By the way, why would I want to create an upward rotation of my scapula? When do I need to do that? Just raise your hand if you know the answer. Thank you, Ms. Janas. But Ms. Petrie, go ahead. I was just thanking Ms. Janas for her. She caught what I was doing. Yeah.
Can you repeat the question? I'm sorry, they're doing a bunch of construction outside, and I can literally hardly hear you now.
It's okay. So I just said, when would I want to upwardly rotate my scapula? I'm about to show you how the trapezius, the upper and lower fibers, believe it or not, work together to upwardly rotate my scapula. But I'm like, why do we care? When would I upwardly rotate my scapula? And you very kindly raised your hand and asked me to kind of clarify the question.
Oh.
So, do you have an answer?
Raising your hand.
Yeah. If I come up above here, everybody, this is the end of my glenohumeral joint. That's it. Deltoids are done. This is upward rotation of the scapula. My acromion process here, watch. Do, 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 do. It moved up. How does that happen? Well, kind of picture it like this. Here's the head. That's not very good. Hold on. It's kind of hard to explain, but here's your scapula. We can see that the upper fibers of the trapezius could lift it up, right? Believe it or not, the down fibers are attached to here on the spine of the scapula, and so they help too. They pull this side down as the other side gets pulled up, and so they both help. The upward and lower, upper, superior and inferior fibers of the trapezius help with an upward rotation. Because literally, the upper fibers help to rotate up, and the downward fibers help to pull it down. Think about when you're driving a car. You're actually lifting the steering wheel on this side and pulling it down on this side. And that's what your trapezius does. It pulls it up here, and the lower trapezius pulls it down to get it to upward rotate. So strangely enough, when I'm like pushing stuff above my head, I'm using delts and all that kind of stuff, but I'm using my upper trapezius and my lower trapezius to rotate my scapula up. Kind of cool. Kind of cool. All right. Good stuff. Cool. All right. Who have I? Miss Yanis. Miss Yanis, what are the insertions of the trapezius?
You already called on me.
I did? Yeah?
Yeah.
Can't do it again? Okay. Miss Yanis, what are the insertions of the trapezius?
The lateral 1/3 of the clavicle, the acromion process, and the spine of the scapula.
All right. Different muscle. What are the origins of the deltoid?
The lateral 1/3 of the clavicle, the acromion process, and the spine of the scapula.
Yes. This muscle beautifully, the trapezius beautifully runs down here, grabs on here, and becomes the deltoid. And they're very different muscles. Now, one is moving, the deltoid's moving the glenohumeral joint, and the trapezius is moving the scapulothoracic joint, but they work beautifully together. Well done. Thank you. By the way, where does the deltoid insert, Ms. Jones?
Isn't it the deltoid tuberosity?
Yeah. On what bone?
The humerus?
Yes. Thank you. Very good. Awesome, awesome, awesome. Okay, so that was traps and delts. That's kind of cool. Yeah, that was kind of cool. Miss Petrie, what are the actions of the deltoid? Dun, dun, dun.
Actions of the deltoid, isn't it?
Think of your own. Yeah.
Duct?
AV duct, sure. Middle fiber, well, all fibers, but definitely middle fibers, AV duct, yeah.
Okay. It also does it rotate? Does it do a medial rotation?
It does do a medial rotation. Which fibers do a medial rotation?
Oh, crap. Let's see.
Do a medial rotation, and think about where those fibers would have to be to make that happen.
The deltoid has. I'm trying to think of what the deltoid fibers. Are they upper, middle, and lower, or are they medial and lateral?
Well, you know where they, you know where they connect now, so you can actually figure this out. You've got some that are on the lateral 1/3 of the clavicles. The clavicle,
Yeah.
that's kind of anterior, right?
Right.
You've got some on the acromion process, that's kind of lateral, and you've got some on the spine of the scapula, that's posterior. So
Okay.
we call them anterior, middle, and posterior fibers, but that helps you.
Okay.
Good.
So then it would do a medial rotation of the upper fibers then, or the, what did we say it was? Medial fibers?
Middle fibers?
The ones that attach to your clavicle.
Okay, so what are those fibers what are we gonna call them? You're right, give me a name.
Interior.
Anterior fibers, yes! We got there, we took the long road, we went the scenic route, we checked out the houses, we stopped for coffee, we had a drink, but we got there, right? Cool. Anterior fibers.
The lateral fibers.
Call them middle fibers, but they are on the lateral side, you're right.
Middle fibers would be the ones that do an abduction.
Yes. By the way, just to warn
And
you,
then-
most people argue that all fibers help with an abduction, but I like to focus on the middle ones because they're the main ones that it helps us kind of understand how kinesiology works. But anyway, you are right.
So then would the posterior do a traction?
A traction, so this is
like
a new thing.
Lateral rotation?
I don't know, would they?
I don't know. I don't know what you call it. Is it a lateral rotation of the deltoid?
This is a lateral rotation. This is lateral, this is medial. You just decided that this diagonal muscle in front does medial. I've got a diagonal connection in back. Do you think it does lateral rotation? What?
So it's a lateral rotation then?
Yeah, which fibers do that?
The posterior fibers.
Oh, good, okay. Wow, we took the direct.
Back.
The one's back. Posterior fibers, good. So far you've got medial rotation, anterior fibers, all fibers, but definitely middle ones doing an abduction. Posterior fibers doing a lateral rotation. Any other movements that the deltoid can do?
They help with giving hugs. Is that a bilateral medial swing arm? I don't know.
What do we call movements in front of our body?
Medial.
You lied. You're melting down. You were doing great there for a while. But flexions.
I'm
Flexions.
telling you, this construction outside right now is killing me.
All right. Do you want to pass the baton to Miss Walker while we still have her
Is
here?
it horizontal something?
It's just a flexion.
Oh, it's just a flexion. Oh my god.
So
Okay.
the fibers, some of the fibers can create a flexion. Which fibers of the deltoid can do that?
It'd be the anterior fibers.
Yes! And
Because
also,
what happens in front of you?
and your deltoid can also do an extension. Which fibers can do that?
Posterior.
Okay. And there's one last thing the deltoid can do. If I'm up like this, what's this movement called?
That's called an abduction.
It is an adduction, more specifically a horizontal adduction. Horizontal adduction, which fibers can help with this?
God.
Last question, which fibers help me do a horizontal adduction?
That would be the anterior fibers.
Yeah. All right.
Because it's happening in front of you.
Yes. Thank you. Thank you. Yes, good. Okay. Real quick lightning round of questions and we'll release some homework here. Not for you, Miss Petrie. I think we, short-circuited your brain. Yeah.
Short circuit today. Most days. Let's just be real.
Miss Hanson. I say him for spinatus. You say what?
Teres minor.
Thank you. Miss Bilotic. I say latissimus dorsi. You say what?
I was gonna say rhomboids, but
Give me a Terry's. Give me a Terry's.
Teres major?
Thank you. Terry's major with latissimus dorsi. They're both big. Thank you. Miss Torres. Muscles that go to the thumb have what word in them?
Palaces?
Pollicis with a P, yes. Miss Hunter. Muscles that go to the big toe have what word in them?
Hollisis.
Hollicis with an H. Thank you. Miss Moore. Muscles that go to my little pinky toe or little pinky finger have what name in them? Miss Moore, are you there?
I am here.
Okay, well good. Well tell me then. Muscles that go to my little pinky finger or little pinky toe have what name in them?
No.
They are phalanges and they are phalanx. I got that. But remember there's a word that we see, two words actually, that we see in muscles that go to little pinkies, little toes. It was on last night's homework.
Digit mini-me.
Digity mini-me.
Yeah.
Digity mini-me. Thank you. You get $1 million now. Cool. Thank you. Miss Felix Osuna. The flexors in my forearm can be found on which side? The flexors in my forearm can be found on which side?
Is that on the anterior?
It is all day long. Thank you very much, ma'am. Miss Nguyen, the extensors on my forearm can be found on which side?
Anterior. You add again.
The extensors, the things that let me extend my wrist and my fingers, on my forearm can be found on which side of my forearm? Which side?
Anterior.
That's this side. I want to go that way. Can muscles on this side pull me that way?
Oh, posterior.
Posterior. Thank you very much, ma'am. Cool.
I'm sorry.
No, don't be sorry. We're just learning. All we're doing is drilling, right, everybody? It's been 5 months of drilling. One day there will be no more drilling. I promise. And you will thank me, though, for all this time. Miss Cooper. Miss Cooper.
What?
Miss Cooper, I say infraspinatus, you say what?
Teres minor.
Thank you. Miss Bilotic, isolatissimus dorsi, you say what?
Teres major.
Thank you, ma'am. Miss Harper,
Yes, sir.
if I have muscles that run to the majority of my fingers or toes, 3 or 4 fingers or toes, that muscle probably has what name in it?
Now I'm blocked.
It's a lot of pressure. Don't worry.
Because the big toe is
Yeah, not
digitarium.
digitorum. Awesome. I love it. Thank you, ma'am. It's hard answering under pressure, huh? Let's see. What did I do? Miss Stanley? Miss Stanley, hello. What are the five, cancel everything I just said. Forget it. Start over. What are the 4 rotator cuff muscles found on my scapula that attach over to my humerus? What are the 4 rotator cuff muscles?
Supraspinatus, infraspinatus, teres minor, subscapularis.
Yeah, really good job. Which one is responsible for an abduction of the shoulder?
Supraspinatus.
She's right, everybody. It's on top. It pulls my shoulder out like that. Good. Which 2, which is a clue, which 2 do a lateral rotation?
Infraspinatus and teres minor.
Yep, they're behind. They grab there. Boom. Which one does a medial rotation?
Subscapularis.
Yes, because the subscapularis, think about this, everybody. We think of the subscapularis as being under, but it's in front. It's in front, and it grabs in front, and so it causes a medial rotation. Fantastic job. Thank you. Yeah. Miss Walker, do you know the deep 6 lateral hip rotators?
The deep 6 lateral hip rotators.
Yeah, we haven't done them yet. Yeah.
Piriformis, the gemellus superior, gemellus inferior, the obturator externus, obturator internus, and then quadratus femoris.
Yeah. Do you know which one's the most superior? Meaning literally it's just the highest up on the butt?
The piriformis.
Yes. You've got a very good memory, so you probably know which one is the most inferior.
Quadratus femoris.
Yes, and the other ones lie between there, which is why I make this emphasis so people know where to find them. They're actually all wedged in your bottom in a space about this big. Fantastic. What is the major action of the lateral hip rotators?
They laterally rotate the hips.
Exactly. That's exactly right. Which one is responsible or blamed for, I'm not sure if it's blamed for pinching the sciatic nerve?
The piriformis.
Piriformis pinches, yep. Very good, thank you. Miss Monreal.
Yes.
What are the muscles of the back fascial line? And fascia, the back fascial line. Let's start at the feet.
Okay. So let's start at the knees. So
At the feet.
Are we gonna do the hamstrings and the calf muscles and glutes?
Well, hold on. Let's start at the feet.
Okay. I thought you said the knee.
Oh, sorry, the feet.
Oh.
What is
Okay.
what is the fascia on the bottom of the feet called?
Plantar fascia.
Yeah. So that's where they start. Then what's next?
The calf muscles.
Which one? Or all of them?
Oh, okay. Gastrocnemius, plantaris soleus.
Yeah. Does the soleus cross over the knee joint?
Oh, wait. Hold on. Let me use my brain. I don't think so. No, it doesn't.
No. So it's not part of the back fascial line. Back fascial line is plantar fascia, gastrocnemius.
Okay.
Then, where does it go to next? Gastrocnemius kind of crosses over, runs into some other muscles. What are those?
Hamstrings.
Hamstrings. Which hamstrings are part of the back fascial line?
Are they all?
All of them. Thank you, ma'am. Then we get into, you can argue the glutes are involved. It's kind of hard to say, glutes. Then, what's the spinal erector that's part of the back fascial line?
Longissimus.
Yes! Thank you. And then you could argue this thing kind of goes to the front or goes in the galeapnerotic, all that kind of stuff. Good job. Thank you, ma'am. Good thinking.
Okay.
Cool. Okay. Last question. Mr. Kandaris. Good sir. I honestly don't know the answer to this too. We're all going to have to kind of do it together in a way. Like off the top of my head, I don't have like a list. What are the hip flexor muscles? There's various ones. That's why I meant. Like, what are the muscles that flex the... Yeah, hip flexor muscles.
Well, the TFL.
TFL, right, and the TFL, yeah, definitely, hip flexor muscle, good. Tensor fascia lata, definitely hip flexor muscle, thank you.
Rectus femoris.
Rec fem, definitely hip flexor muscle, you're doing great, yeah.
Let's see.
Those are big ones, by the way, that he got. But there's more.
Yeah,
You want to throw it out to the group?
sure, I'll throw you a pass.
Okay. Anybody, give us more hip flexors. We got tensor fascia lata, which hooks to the IT band and happens to be kind of in front, so it can act as a hip flexor. We've got rectus femoris, which is one of your quads, the only one that crosses over, definitely a hip flexor. Miss Monreal, yeah.
Iliopsoas.
Iliopsoas. By the way, everybody, that is probably your major hip flexor, more than any of them, the iliopsoas. Iliopsoas, which is inside your tummy, going down inside your hips. Miss Harper, you got another one?
Sartorius?
She is right, isn't she? It's a hip flexor too. We're not saying these things don't do other stuff, but, poor ES, but they definitely are hip flexors, yes. Let's see, Miss Torres, do you got something else for me?
Gluteus minimus?
Yeah, glute min. By the way, some people would argue medius, and they might be right too, because there's anterior fibers of the medius, but I just don't want to get that nitpicky, but that would have been an acceptable answer, the anterior fibers of glute medius. So sartorius, TFL, rec fem, iliopsoas, glute min. You might be able to argue certain adductors are close enough to do this, but I'm not that worried about it. Anything else? Are we missing anything? That's the stuff that comes to my mind. But as we found out yesterday, not everything comes to my mind. So, yeah. Yes, Miss Nguyen.
How about hamstring muscle?
Which muscle?
I think the bicep femoris,
No, those are the opposite of hip flexors. Those are hip extenders because they're in back. They're in back, and so they actually pull me back. These are muscles that pull me forward. Those are important too, by the way, to pelvic alignment. But we're talking about stuff that pulls your pelvis forward or your legs up, not stuff that pulls your pelvis back.
Okay.
But it's good. I'm glad you guys are guessing and jumping in there. Miss Hanson.
If the TFI is one, then won't the IT band be one?
Well, so even if the TFL is one, the tensor fascia.
TFL.
So Sure, but the IT band isn't a muscle.
Huh?
In fact, I'm glad you said this because it leads to a very interesting question. Really, if you guys can see this, your tensor fascia lata is this muscle about this size here, and it hooks into the IT band, which is a fascial band here, that then goes into the leg, the side of the leg. What does that make the IT band? Like, what's another thing you could call it?
Is that a ligament?
Does it attach bone to bone, or does it attach a muscle?
Yeah.
It's what?
What's the other one?
It's that day for everybody, apparently. It's a tendon. Like, you could argue it's a tendon. It's a tendon kind of for the glutes and the TFL to go in the IT band. And you could argue the IT band is a tendon. Now, somebody come back and say, well, it's not rope-like enough or whatever, but whatever. It's essentially a tendon. That is one way to look at it. Cool? Thank you, by the way. I hope you know how sincerely I mean this. I love wrong answers. Right? Because it means you guys are trying and we are communicating and we're jumping in there and it allows us to have other side conversation. I'm not just talking about you, Miss Hanson. All the wrong answers been said because it's so much better than this. You know? It's really how we learn. So I absolutely love it. And TFL wasn't wrong. I mean, the IT band wasn't wrong, but it gives us a chance to talk about what is the IT band. Clarification. Anything else? That's all the hip flexors I can think of, but probably tonight when I'm laying in bed, I'll be like, ah. Good. Okay. Let's do some homework. Yeah, or do we have more questions? Ms. Torres, do you have more questions? Your hand's still up. I don't want to ignore you. No. All right. Let's release your homework. I don't think it's a lot. Let's find out here. Hold on. All right. Let's see.